All right, let's dive right in. We're going to be talking all about the medications for type 2 diabetes. And believe me, the way we treat it has changed a lot. So let's get you completely up to speed on how things are done today.
So you get the diagnosis, type 2 diabetes. It can feel like a ton of bricks. And right away, the questions start flooding in, right? Okay, now what? What's the very first thing I do? What are my options? Well, we're going to break all of that down.
You know, for a long time, the game plan for treating type 2 diabetes was pretty much the same for everybody. But we now know there is no single magic pill. The whole idea of a one-size-fits-all solution, that's officially a thing of the past.
Instead, the way we think about diabetes care now is that it's all about you. The right treatment isn't just a prescription. It's a completely personalized journey that's based on your specific, unique health profile.
So what are we even aiming for here? Before we get into all the different kinds of medications, let's just be crystal clear on what winning looks like when it comes to managing diabetes.
The number one goal is getting your A1C under 7%. Now, if you're not familiar, just think of your A1C as your average blood sugar over the last few months. It's kind of like the main report card that tells us if the treatment plan is actually working.
Okay, so we have our goal. Where does this journey almost always begin? Well, for the huge majority of people, it starts with one single foundational medication. And that medication is metformin. It is the absolute go-to starting point for type 2 diabetes, our first line of defense. And there are some really good reasons why it's earned that top spot.
So how does this stuff even work? Well, your liver is constantly making sugar to give your body energy. But with type 2 diabetes, it can go into overdrive. Metformin's main job is basically to call up the liver and say, hey, ease up a bit. It's like turning down the faucet on that internal sugar factory.
And this is where metformin is just fantastic. It's not just about lowering a number, it actually reduces the risk of big heart problems. It doesn't make you gain weight, and, this is a big one, it won't cause your blood sugar to crash. That's a dangerous condition called hypoglycemia. So, it's safe, it works, and it's affordable. It's a powerhouse. But what happens if metformin, along with diet and exercise, just isn't getting you to that under 7% goal? This is where the modern, personalized approach really kicks in. The next step isn't just a guess, it is a very deliberate choice made just for you. This right here is the game changer. For decades, the only goal was lower the blood sugar. But now, doctors look at your entire health picture. The next medication isn't just chosen for your sugar levels, it's chosen to protect your most important organs, like your heart and your kidneys. We've moved from treating a number to truly protecting a person.
And this slide lays it out perfectly. This is personalized medicine in action. If you've got heart disease from plaque buildup, the clear choice is a class of drugs called GLP-1 receptor agonists. But if the bigger issue is heart failure or kidney disease, then you're looking at SGLT2 inhibitors. It's all about matching the right defense to the biggest threat.
Okay, let's zoom in on that first class, the SGLT2 inhibitors. You're about to see they work in a completely different and honestly kind of brilliant way.
So, SGLT2 inhibitors work with your kidneys. Normally, your kidneys filter sugar out of your blood, but then they pull it right back into the body. What these drugs do is block that. They basically open up a special escape hatch so all that excess sugar just leaves your body through your urine. It's a really clever way to lower blood sugar without messing with your insulin at all.
And the benefits here are just huge. I mean, we're not just talking about better A1C numbers. These drugs are proven to lower the risk of dying from cardiovascular events, they protect your kidneys from getting worse, and they usually come with some pretty nice side bonuses like weight loss and lower blood pressure.
All right, now for the other major player we mentioned, the GLP-1 receptor agonists. Remember, these are the top choice for patients who have heart disease caused by plaque buildup, and they have some really unique superpowers.
Think of GLP-1s as the Swiss Army knife of diabetes drugs. They attack the problem from all sides. They help your pancreas release insulin, but only when you need it. They tell your liver to chill out on making extra sugar. And they slow down your digestion and send a signal to your brain that says, hey, we're full. It's a three-pronged attack.
And the results of this multi-tool approach? They're a really big deal. These drugs can lead to some serious weight loss. You've probably heard of some of them on the news. Specific ones are proven to drastically cut the risk of heart attack and stroke. And, just like metformin, they do it all with a very low risk of making your blood sugar go dangerously low.
Now, even though SGLT2s and GLP-1s are the ones making all the headlines, especially for high-risk patients, they are definitely not the only tools in the toolbox. We have a whole arsenal of other oral medications that can be used to really fine-tune a treatment plan for anybody.
And this little table shows you exactly why things have changed so much. You look at older drugs, like sulfonylureas, sure, they lowered blood sugar, but the cost was a real risk of dangerous lows, hypoglycemia, and they usually made people gain weight. It's a perfect snapshot of how far medicine has come.
Okay, let's talk about insulin. For a lot of people, that word can sound kind of scary, but it's so important to see it for what it is. It's not a punishment, it's not a sign of failure, it's just an incredibly powerful and often very necessary tool to help you stay healthy.
And this is a really important thing to understand. Type 2 diabetes is a progressive disease. That just means it changes over time. For most people, their body's ability to make its own insulin slowly goes down. That's not anyone's fault. It's just the nature of the condition. And that's why, for many, insulin eventually becomes the logical, necessary next step.
And starting insulin is almost always a very gradual process. You're not going from 0 to 100. You'll likely start with just one shot a day of a long-acting or basal insulin to give you a steady foundation. Then, only if you need it down the road, you might add a rapid-acting insulin at mealtimes. It's a totally manageable progression, and your doctor is there to guide you the whole way. So, when you step back, you see that type 2 diabetes treatment has gone from a one-size-fits-all pill to this deeply personal strategy. It's not just about a number anymore. It's about protecting your entire body for the long haul. Which, it makes you wonder, right? With care this personalized, is this what the future of treating all chronic diseases is going to look like?